Okay, good morning, everyone. I see we still have a couple people filtering into the room. I'm going to give it one more minute before we start. So if you've been on this call already for a couple minutes, thank you for your patience, and we'll get rolling here in a few. Okay, it looks like our attendees are slowly starting to trickle in. So I'm going to kick this off here. So good morning and welcome, everyone. My name is Abby Tynan. I use she, her pronouns, and I am the communications coordinator here at the CSU Health Network. And we are every student's on-campus home for health and well-being at CSU. So today I'm going to be going over the services that are provided for you at the CSU Health Network, and I'm also going to be reviewing the new student requirements and recommendations. And I do have a fair amount to cover in today's presentation. This should take about 30 to 40 minutes, kind of depending on how things go this morning. So I am going to be answering questions at the end of this presentation. That being said, if you have a question or in the middle of the presentation or at any point, please feel free to utilize the chat function or the Q&A function, and you can type those questions in there, and then I will make sure that we answer those at the end of the presentation. We do have some representatives from the CSU Health Network on this call today, and they will also be answering questions at the end. So we have Katie from our Student Health Insurance office, and so she's happy to answer any questions regarding the Student Health Insurance Plan. And then Andrew should be joining us at some point if he's not already on, and he is a representative from our counseling services. So if you have questions about how mental health support services work at CSU, he'd be happy to answer those questions for you. So at this point, we're going to kind of dive in. I do want to note that all of the information that's covered in this presentation is also listed on our website, which is health.colostate.edu. So if you need a refresher after this presentation or just need some more information about how the Health Network works, feel free to visit health.colostate.edu, and hopefully you can find answers to your questions there. All right, so diving into a little bit about the CSU Health Network, who are we? So at the CSU Health Network, we are here to support you during your time at CSU. So we are every student's on-campus home for healthcare. And if there's something that you can take away at the end of this presentation, it's that you have full access to all of our services. And that includes medical, counseling, and health education and prevention services. And so we do pride ourselves on integrated care for the whole student. And so unlike other colleges and universities across the country, we do have integrated medical and counseling services. So we don't like to look at students as pieces and parts of themselves, but we like to look at them as one larger unit. And we know that health and well-being is such a critically important part of your experience and success as a student on your path to graduation. And we truly feel like we have the services that can support you on that journey to graduation. So as I mentioned, we do have all medical, counseling, and health education and prevention services, and you have access to all of those. So we are your first stop for medical and counseling needs. And one thing that's really great about healthcare in the United States is that we are private and confidential. So no one knows what you've come to the health network for unless you want them to. And one of the questions we also get asked pretty much every summer at some time during orientation is, do you have real doctors, or are these students practicing on students? And the answer is we do have real doctors, and they are board certified and they are accredited. And not only that, they are passionate about working with the college student population. So when you come to see us, you will be in good hands. And like I said, all of your visits are private and confidential. So no one is going to know what you came to see us for unless you want them to. So now we're going to take a deeper dive into those three main service areas that I talked about. We're going to start with our medical services here. So our medical services are broken up into two parts. So we have our general medical services and we have our specialty medical services. So as part of our general care, we do offer regular primary care. So anytime you just kind of need a checkup, you can come in and see us. I also want to note that we have a pharmacy on our first floor. So if at any point you need a prescription during your time at CSU, you can come pick that up directly from us. We also have over-the-counter medication. So even if you just need maybe some ibuprofen or a Band-Aid or even, lotion, you can come and get that directly from our facility. Then we have a lot of really great specialty medical services that some people may not think that we have. So we have an allergist and immunizations clinic. We have optometry. So you can not only get your eye exam at our facility, you can even pick up contacts directly from us if you wear your contacts. We have a dentist, so you can get your teeth cleaned. We have physical therapy. We have all sorts of services to treat students all under one roof. So we feel very fortunate. So if you are ever interested in accessing our medical services, you can either schedule an appointment online or you can call us. And students are definitely best served by making appointments. However, if students are injured or need immediate medical attention, whether you're vomiting, whatever the situation may be, you can walk in and access our services. And I do want to note at this point in the presentation that you will be hearing how the CSU Health Network works in general. But because of COVID-19, some of our services may be shifting a little bit. And so we definitely encourage you before you come to the health network, please give us a call. So at this point, we are not actually accepting walk-ins for care. After the pandemic is over, whenever that may be, I'm sure our services will transition back into welcoming walk-ins. But if you can make note before you come to our facility, please call us. But I am going to keep telling you kind of how our services would work normally, and I will jump in with any changes that we will have had to adjust to because of the pandemic. So as I mentioned, you can make an appointment online or you can call. And at this point, please call us before you come into the health network. However, after COVID-19 is over, if you do need immediate medical attention, you can walk in and access our services. And I do want to mention that you will need to bring your CSU student ID at any point that you have an appointment at our facility, and then your insurance card. And so I had mentioned that Katie from our insurance office is on this call, and so she'll kind of take a deeper dive into how insurance works at the end of this presentation. So as I mentioned, some of our services have changed because of COVID-19. And so while we do expect all of our services to be available in some capacity in the fall, we're currently offering some of our services in a combination of ways, meaning that we have some services in person and we have others via phone or secure video conference. And this is just to make sure that we're in line with current public health requirements. And so while we're still kind of holding out to the last minute to figure out exactly what our services for the fall are going to look like, I do want to mention that we don't expect any of these services to not be available to students or to go away. It's just that some may be available in person, whereas others may be available via secure video chat or phone conference. And again, as I mentioned, if you have questions as the summer goes on, please feel free to visit our website, health.collegestate.edu. We are updating that frequently with our most current service information. So that's a great resource for you, or you can always give us a call if you need to speak with someone too. We do know that the COVID-19 situation is evolving quickly, and sometimes it can evolve week by week or day by day. So just know that we're aware of that, and we're going to always keep our website updated just so you can have the most current information possible. So now moving on to our counseling services here. So we are very proud of the robust culture of help seeking that has been embraced by CSU, all the way from the Board of Governors to the President's Office to faculty, staff, and students. And we know that mental health care is really a priority for CSU and for CSU students. And so our counseling services are actually one of our most utilized services at the CSU Health Network. And one thing we like to tell students is that it's never too early and it's never too late to access the care that you need. And so by paying student fees, all students get access to a wide range of mental health support services. And this can include skill building workshops, group therapy, and individual and couple sessions. So that's one major way that counseling services differs from medical services, is that we do not bill insurance for our counseling services. So your counseling fee, which is part of student fees, provide access to all of the mental health services that you see on screen. So it's those individual sessions, groups and workshops. If you have substance use questions or need help with drugs and alcohol, our counseling services can help you with that as well. Then we can also help connect you to other campus resources that are really important. So if you are ever interested in accessing our counseling services, you can come to our counseling services, and our licensed professionals will work closely with you to determine the services that are right for you, given your goals, your preferences, and what's clinically appropriate. So now I want to take a deeper dive into exactly how to access counseling services. And so again, this is pre-pandemic messaging here, but for new students that want to access counseling services, the first step is to come and see us. It's just that right now for counseling services, coming and seeing us means please give us a call. We have folks that are working our phones during our drop-in hours, and you will be able to talk through your areas of concern, your goals, your history, your unique circumstances, as well as your identities, and we will work together to create a wellness plan or kind of next steps that best fit your needs and your preferences. So this could be individual counseling, it could be a group or workshop, maybe online resources across campus, or maybe a combination of those things. So again, if you're interested in accessing counseling services, the best thing to do is to give us a call, and we will connect you with the services that best fit your needs. And we did find out recently that all of our counselors will be working remotely for the fall semester. So we will be continuing on with video conferencing and phone calls. So please make note of that there, that all of our counseling services will be delivered basically by telehealth. So just know that. So now moving on to our health education and prevention services. We're very proud of all the robust skill building programs and services that are offered through health education and prevention services, otherwise known as HEPS. So you can think of HEPS as kind of our outreach arm. So we are trying to provide students with the education and the tools that they need to be successful during their time here at CSU. So some of our health education and prevention services include stress reduction. We provide support to help you quit smoking if you're a smoker. We also offer mindfulness meditation, substance abuse prevention, sexual health. And then at some point during your time here at CSU, you may hear the phrase Rams take care, Rams take action. And that comes out of our bystander group crews. And so they do a lot of really good work around choice making, bystander behavior, what it means to look out for your fellow Ram, and how to spot a student in distress. So if you ever hear the tagline Rams take care, Rams take action, that's coming out of our office at the Health Network. Okay, so for those of you who maybe have not been to Fort Collins yet, this is a picture of our building. So this is the CSU Health and Medical Center here. So the CSU Health Network is housed within the CSU Health and Medical Center. The CSU Health Network occupies the entirety of the second and the third floor, as well as some of the first floor. And we actually only exist to serve students. We do not serve faculty members, staff, or even the community. So we exist solely to support your needs. And this map here, I do want to know a few important things about our location. So I know some of you may be starting the semester from your home country, but I think that this is really important information if you end up coming to Fort Collins for the spring semester or at any point during your time at CSU. This is important information to know. So a couple things I do want to know about our parking lot. So if you have visited our campus, you may have noticed that parking is definitely kind of a hot commodity. And so when we were building our facility, we never wanted the cost of parking or the availability of parking to be a barrier to students accessing services. So I believe we are one of the only free lots on campus. So if you have a car when you are in Fort Collins and you need to access our services, you can park at in our parking lot for free if you have an appointment at the CSU Health Network. And then I also want to note the around the horn stop. So if you are living on campus or even at any point kind of between classes, if you're needing a fast way to get around campus, you can utilize around the horn. So around the horn is a campus busing system that has stops outside different residence halls and academic buildings, and it does have a stop outside of our facility. So around the horn is another great way to access us. And then the last piece of information that I want to note on this map is the MAX stop. So the MAX is a Fort Collins public busing system that parallels College Avenue, which is our main road in town. And so CSU students can ride the MAX bus for free with their student ID. And the MAX bus has numerous stops, obviously, throughout the city of Fort Collins, but also has a couple stops on campus. So if at any point, depending upon where you are on campus or where you are in the community, the MAX bus is a great free way to access our facility. And that does have a stop a couple hundred feet outside of our west entrance. So just a couple of things to take note of here. So now that you know a little bit about our services, you may be wondering, well, why do they exist? Why is the CSU Health Network here? And we are truly here to help you with your medical and mental health needs so that you can succeed during your time here at CSU. We want to help you get healthy, stay healthy, adjust to a new environment, and solve problems. So when can you access our services? This is a great question. So we are open Monday through Friday, generally about 8 a.m. to 5 p.m. We do have adjusted hours for breaks such as fall break or winter break. So definitely check our website, but for the most part, we are open from 8 a.m. to 5 p.m. We do have phone helplines for after hours if you are experiencing whether it's a mental health crisis or if you need to speak with our on-call nurse. So please know that you do have access to those phone support helplines there at night and weekends. And then also, I definitely want to encourage you, please don't wait to access our services. Please know that your access begins the week before classes start. So pretty darn soon, right? So come and access our services early when problems are starting versus waiting. So how to access our services. So as I had mentioned, because of COVID-19, we are encouraging students always call us first before you come into the building. So you can call 970-491-7121 to make an appointment. We are currently not doing walk-ins, but once the pandemic is over, we will be opening those up again. And then of course you can schedule an appointment online. Some of our services are limited currently because of coronavirus. So again, please check our website and always call before you come into our facility. So as I mentioned, the CSU Health Network is only open Monday through Friday about 8 a.m. to 5 p.m. So what happens if you do get sick after hours or on the weekends? So of course, if you get sick at any point during your time at CSU, we always encourage you to come and see us first, right? We are on campus and we offer all of those medical and counseling services that I had mentioned at the beginning of the presentation. However, like I had also touched on, we do offer these phone helplines. So we have a 24/7 nurse helpline that is staffed with one of our registered nurses. So you can give that number call and our nurse can help talk you through whether, depending upon your symptoms, if it's appropriate for you to maybe wait until the next day and access services at the CSU Health Network, or maybe you're sick enough that you may want to consider accessing care at a local urgent care facility in Fort Collins. We also have our mental health crisis intervention line that's listed on screen. So if at any point you are experiencing a mental health crisis, you can call that number and speak with one of our licensed professionals and they can help you. So say you are, sick on the weekend and we're closed and you call a 24/7 nurse helpline and the nurse recommends that you go see a local urgent care in the community. We do have a full list of local urgent care facilities in the Fort Collins area at health.colostate.edu. And I do want to mention here, and I think we will actually be going over this again at some point later in the presentation, but I feel like this is important to kind of hit home, is that healthcare obviously works a little bit differently in the United States, and emergency care is actually quite costly and can be very expensive. So we always encourage you to come and access services at our facility before going to emergency care. This is just the most cost-effective way. And then of course, accessing that 24/7 nurse helpline will help you navigate the appropriate route for care if we're closed, and they can help you kind of navigate those decisions there as well. So as I mentioned, emergency care is costly, but of course, in the event of a life-threatening emergency, please call 911. We do have the Poudre Valley Emergency Room, and that's located on LeMay. So that is the closest emergency care facility to campus. And then we also have Banner Fort Collins. And so that's another option for you as well if you do need to seek emergency care. So how will you pay? Again, healthcare works different in the United States, right? So your health insurance is going to help pay for medical services. And so what you owe depends on your health insurance plan benefits. So as I mentioned, Katie is on this call and she can talk a little bit about how the student health insurance plan works at the end of this presentation. And as I had also noted, medical and counseling work differently at our facility. So we do bill medical insurance for medical services. However, your counseling fee provides access to all of those mental health support services at no additional cost to you. So I know that we are remote right now, so this won't work exactly like a traditional quiz, but I figure you can just kind of answer to yourself for these quizzes just to make sure that you kind of know the ins and outs of the health network and what we've chatted about so far. So our first question of our pop quiz is, what services are provided at the CSU Health Network? Is it A, medical services, B, counseling services, C, health education and prevention services, or D, all of the above? So take a second to think about that. All right. Or what? I just woke up. And the answer is D, all of the above. So CSU Health Network is every student's on-campus home for medical and mental health needs. So pop question number 2, do you have to be really upset to see a counselor? A, yes, B, no. C, they said no, but I think you do.
So Abby, I'll just let you know that we are getting some things in the Q&A.
Oh, sure.
So I should have shared that before, but I just noticed it. So right now we have one answer that says no for this one.
Okay, great. So the answer is no. So whoever said no, that is correct. You do not have to be really upset to see a counselor. Our counselors are here to help you with your problems, whether they are big or small. And we like to say, again, it's never too early or it's never too late to access counseling services. So yeah, if you do want to chat your answers to these questions, that's just fine. So question 3, what are reasons to come to medical services? A bad sore throat, B, headaches, C, sickness, D, questions about women's health, or E, all of the above. All right.
And we're getting lots of E's in here.
Excellent. Yes. So the answer is E, all of the above. So if you are not feeling well, or if you have health concerns, please come and access our services. Again, because of COVID-19, we're encouraging everyone to give us a call before coming into our facility. But yes, you can access our services for all of the above. All right, question number 4. Should you go to the hospital if you have a life-threatening illness? A, yes, B, no. All right, what are our thoughts here?
We have A's coming in.
Yes, so if you have a life-threatening illness or an emergency, you should definitely go to a hospital or call 911. All right, question 5. Who will we tell about your visit if you come to the CSU Health Network? A, parents, B, teachers, C, friends, or D, none of the above?
Lots of D's.
Perfect. That's right. None of the above. So the CSU Health Network is completely confidential. We won't tell anyone about your visit unless you want us to. Okay, so that wraps up our pop quiz. So at this point in the presentation, you should know a little bit about the CSU Health Network. You've heard about our medical, our counseling, and our health education and prevention services. And we've also talked about what it looks like to seek care after hours and what emergency care looks like. So at this point, we're going to be moving on to the new student checklist portion of the presentation. And so we've had some questions this summer about because of the pandemic, will any of these deadlines be extended? And the answer is no. All of the deadlines that are presented in this presentation are the deadlines. So most of these will be the first day of classes, which is Monday, August 24th. So please make sure that you meet those deadlines. So let's dive into the new student checklist. So some important websites here include health.colostate.edu as well as ramweb.colostate.edu. So again, if you need a refresher on any of this information after the presentation is over, you can visit our website and all of that information is located there. So our first requirement here, submit immunization records. So Colorado law does require every student to submit proof of 2 measles, mumps, and rubella vaccinations. And then for students who are living in student housing, Colorado law requires students to submit proof of the meningococcal vaccination given within the last 5 years. And you can submit all of your official immunization records online through the CSU Student Health Portal, and I will be walking you through how to access that portal here in a few slides. And there are detailed instructions about how to meet this requirement at health.colostate.edu/new student checklist/immunizations. So all of these are due by the first day of classes. And so if we do not receive your immunization records by the first day of classes, you will have a hold put on your student account and you will not be able to register for second semester until we have those immunization records on file. So again, that's proof of 2 MMR vaccinations and 1 meningococcal vaccination if you are living in campus housing. So we have some important health forms here to complete. So we have our tuberculosis assessment, which is just in a couple questions online, just a little online screener to assess your potential exposure to tuberculosis. So it's actually just a quick and easy questionnaire. It shouldn't take you too long. And then we also ask you to complete a health history form. So this is just to make sure that we have the complete picture of your health history. So that way, if you do come and access any medical services, our providers know again, what your health history is. So both of these forms can be completed on our CSU Student Health Portal, and you'll want to make sure that you complete both of these by the first day of class. And then for any of you, and I'm not sure again exactly who is on this call, I know there's a fair amount of you, but if any of you are going to be coming to the university under the age of 18, it's very important that we have an authorization for treatment of a minor form. So at age 18, you're considered an adult in the United States. And so, and when you are under the age of 18, we need parental approval before we can provide medical care to you. So if you are going to be under the age of 18, make sure your parents or guardians fill out an authorization for treatment of a minor form. And this can be found at the URL on screen and then submitted to our medical records office. And again, the TB assessment, the health history, and then the authorization for treatment of a minor form, if applicable, is due by the first day of classes. So I said I would walk you through how to access our student health portal. So this here is a screenshot of our homepage of health.colostate.edu. So if you visit health.colostate.edu, you will notice that little quick links tab on the bottom. So under quick links, you can see the student health portal button, and you will click that link and it will bring you to this page here, which is portal.health.colostate.edu. And here you will log in with your e-name and your password. And that's the same that you use to log into RamWeb, for example. And once you log in, it will take you to this page here. And so you will see that there is a button here that says My Forms. So you can always access any of your forms through the My Forms button. But as long as you have yet to complete these requirements, you will always have this "you have pending forms" notification. So that's a great way to know if you have met this requirement or not. So then once you are ready to upload your documents, it can just be even a nice picture taken from your cell phone, just front and back of those immunization records. You can upload those into our document upload button. And I do want to note that all of the immunization records do need to be translated into English. So please make sure that you get those immunization records translated before you upload those documents there. So as noted a couple times in this presentation, the United States healthcare system does work a little bit differently. So I do have a quick video that I want to share with you at this point. Just a little overview of the US healthcare system, and then we will continue talking about the requirements and recommendations. So I guess just let me know if this is not working on your end.
The U.S. healthcare system offers some of the best medical care in the world, but it is complex, difficult to navigate, and often very expensive. The U.S. system will also likely be very different from the healthcare system you are used to back home. In this section of the video, we offer a few simple tips. First, like most Americans, you will need a private insurance plan, either through your school or one that you purchase directly. There is no universal access or national health care like many countries offer. When you seek any medical care, the provider you choose, hospital, doctor, or clinic, will look to you and to your insurance carrier to get paid for their services. There will be no payment from the government, and healthcare can be very expensive in the U.S. Here are a few recent real-life examples. Appendicitis, $60,493. Fractured humerus, $47,445. Fractured clavicle, $18,393. Car crash or serious illness, $150,000 plus. We hope by now it's clear why you need insurance. However, even with insurance, you should still be prepared to pay some portion of the cost of your medical care. Cost sharing is an important element of the U.S. system. So medical care is never entirely free, and each time you access the system, you should expect some cost. While your insurance plan will typically cover the majority of expenses, there will be copays, deductibles, co-insurance, excluded charges, or some combination of these items that will ensure that you pay something. Carefully review your insurance documentation so you understand how these payments work for your plan. When you get sick or injured, where do you seek care?
Okay, so that kind of wraps up that portion of the video, just talking about how healthcare can be expensive in the United States, and actually CSU does require everyone to have insurance. So Katie can talk a little bit more about that later. But I do want to mention how to fulfill the health insurance requirement. So all students are required to have health insurance. This includes international students. And so all international students are automatically enrolled in the CSU Student Health Insurance Plan. And so you are billed for the cost of the plan after registering for classes. However, if you do have health insurance through your home country and it meets the requirements set by CSU, you can opt out through the waiver process if you can show proof of acceptable private insurance coverage. So if you do have other insurance coverage, you can submit a waiver request form and a copy of the current insurance policy to the Student Health Insurance Office. And so the deadline to do this is Wednesday, September 9th, 2020. And you can see on screen what are accepted waivers and non-accepted waivers. So accepted waivers generally include most employer group health plans, approved sponsor plans, or individual plans that meet healthcare reform law. And then non-accepted waivers include whether it's a short-term plan, a foreign plan, or just individual plans that do not meet healthcare reform law. So a little bit about the CSU Student Health Insurance Plan. So the CSU Student Health Insurance Plan, otherwise known as SHIP, pays all costs for most medical services within the CSU Health Network. So you have to be accessing services at the CSU Health Network in order for it to pay most of all costs. SHIP will pay 60 to 80% of most medical costs at a hospital or medical clinic, which means that you're accessing care outside of the CSU Health Network. But this is after you pay a $500 deductible. And then you will get 250 flex dollars to use towards non-covered services at the CSU Health Network. However, the student health insurance plan does not pay for dental care, vision care, elective services, non-medically necessary services, massage therapy, or any over-the-counter medications. So moving on to our required online module section as part of our new student requirements. So alcohol EDU and sexual assault prevention are required for all incoming first-year students. So alcohol EDU provides personalized feedback that encourages students to consider their own drinking decisions and those of their peers. And sexual assault prevention educates students on issues associated with stalking, relationship violence, and sexual assault. And typically both of these would be due on the first day of classes. However, due to recent updates to Title IX federal regulations, the required sexual assault prevention module is not going to be available until August 14th. So coming up in a couple days here. So as a result, the deadline for sexual assault prevention has been adjusted to September 7th, 2020. The deadline for alcohol EDU does remain unchanged, and that will be due on the first day of classes, which is Monday, August 24th, 2020. And so you should already have begun receiving emails alerting you that at least the alcohol EDU program is open and available. So you can log in to access both of these modules through your RAM web account. However, if you do not complete both of these modules by their required deadlines, you will have a hold put on your student account, and you will not be able to register for classes for second semester until both of these modules have been complete. So again, alcohol EDU is already open, so please go ahead and start completing that. And then sexual assault prevention will open up here in a couple days. So I mentioned earlier on in this presentation that at CSU, we do have a strong commitment to mental health support services, and we encourage students to access all of our resources that we have here. Some of these resources are online, and one of those includes You at CSU. So You at CSU is a confidential, customized portal that provides feedback to students to help you meet your goals or address your concerns in 3 areas: succeed, thrive, and matter. So you can actually set up your profile now through RamWeb, and you can start exploring all of the great things that You at CSU has to offer. And it's also a great way just to get connected to resources across campus and see exactly what is available to you as a CSU student. So when you are on You at CSU, you will notice that it is full of different content cards. And so some content cards may just be an article or a video, and other content cards will have a little ram's head on the bottom. And those means that those cards have resources that are specific to the university. So like I said, it's a great way to just see all of the things that are available to you as a CSU student. So that wraps up our new student checklist portion of the presentation. So if you have any further questions about all of those requirements, you can visit our website, which is health.colostate.edu/new student checklist. So I just want to reiterate, we are truly here to help you and support you, and we want your time here at CSU to be successful. So you can always visit our website for more information. And at this point, I'm going to open up the call to questions. But before we start answering questions, I'm going to have Katie pop on the screen here, and she's going to talk a little bit about the student health insurance plan and some exceptions that we are making here because of COVID-19. So I'm going to stop the screen share, and we're going to bring Katie onto the call. Hi, Katie.
Hello, everyone. Hope you're all doing well. So I'm from the Student Insurance Office. We are actually located in the health network as well. Everything's under the one roof, so it makes it really convenient for students. So the way that it works is once you register for classes, you will automatically be enrolled in the student health insurance plan. There are a few exceptions that we're allowing for this semester in particular. One of those is if you are enrolled in classes, but you are not physically in the United States. So you should have, hopefully, if that's your situation, gotten an email from our manager of student insurance letting you know what those different options are. If you are in that situation and you look in your inbox, you look in your junk, and for some reason you have not gotten an email in regard to that, feel free to reach out to our office. And our email is all over our different web pages on the Health Network website. So reach out to us if that's an option, and we will get back to you on what information we would need. We do not hold students who are not in the United States to that insurance requirement. So that's a different one for this semester that we're helping students with and being a little bit more flexible on those insurance requirements.
Great. And then is there, if say an international student comes into the country maybe halfway through the semester and they were maybe covered through their government when they were living at home, is there an option for them if they come to Fort Collins, say in October?
Yes. So depending on if you have coverage or not when you come in, if you're coming mid-semester, we definitely recommend reaching out to the Office of International Programs first. What they'll do is they will go ahead and assess what your insurance level is, and then they'll reach out to us if we do need to go ahead and add you onto the student health insurance plan at that point. Those students will be charged a monthly premium for the months that they'll be in the country after that.
Great. Thank you.
Yeah.
Bronwyn, do we want to open this up for any other questions that have been chatted in? I see there's kind of a fair amount, so we're happy to try and answer those.
We've had quite a few. So I'll start with some that came in earlier or that we've gotten a number of similar questions with variations. So the one about the deadline, to have all those forms. If a student is starting in person, it sounds like that deadline is the first day of classes. What about if a student is starting later in the semester? So they're going to take online and they're going to come later whenever they're able to obtain a visa, or they're fully online for the fall semester and won't be here until the spring. Is that deadline still the 24th?
Yes, the deadline is still the 24th. So we are still viewing all of those classes still as resident instruction classes, even if you may be learning online. I don't think you're still classified as an actual online student. So regardless of where you are learning, all of those deadlines are still applicable. So most of those are the first day of classes, which is August 24th. So you still will be needing to meet those deadlines.
Okay. Can I access counseling service if I study online from my home country?
Yes, you can. So all of our counseling services for the fall semester will be offered via telehealth. So you should be able to access counseling services from your home country. I definitely encourage you to call the health network if you are interested in accessing those counseling services. Again, we like to tell students it's never too early to get the care that they need. And we know that mental health is going to be such a priority at some point throughout, an increasing priority throughout this semester. So we definitely encourage you to give us a call. And I think Andrew just hopped on the call. And so Andrew is from our counseling services. Hi, Andrew. Thank you for joining us. And
Hi.
so one of the questions that we just had asked, and I want to make sure that I'm answering this correctly, is so some international students will be studying from their home country for the beginning of the semester. And so they're wondering if they can still access counseling services from their home country. And I told them, yes, they should be able to, but I didn't know if you have any further information on that.
There are limitations to what we can do because one of the laws of Colorado states that you have to be in Colorado to start counseling services. And so we still would encourage you to call in a mental health crisis, or for even we could sort of offer like single session appointments. But to start ongoing treatment, you would need to be in Colorado. And so if you aren't in Colorado, there might be a limit to sort of like what we can do or the number of meetings you might have up front just because of our licensing laws.
Sure. Could a student still, if they were interested in joining a group or workshop, would they be able to do that remotely?
That's a great question. And I think that the answer would be a group, no, but a workshop, yes. And we are still trying to work that out because we want everybody to come, like we're happy to see everybody, especially if you're a student and you're paying your fees and we want you in there. And really it's just us trying to figure out how to negotiate with the licensing laws of the state. So because workshops don't require you to give informed consent and it's not considered a confidential space, but rather more of an educational space, then we can make workshops work. But certain group therapies are therapy. And so that kind of falls under the licensing laws again. So there are things that we can offer, but there'll be limits to it if you're starting off somewhere other than Colorado.
Okay, great. So would it be fair to say that they can give us a call and definitely check our website as the semester kind of progresses to see exactly what those options are as we still kind of figure things out here?
Yeah, because please call in. We won't just say like, no, we can't talk. Like we'll talk to you and we'll and we can see what's going on and see what we can help with. And if there's something that we can't provide, we're trying to figure out ways to refer people to other sources of teletherapy and things like that that student insurance pays for. And so there are options because I do know that the International Student Plan has a telehealth option. And so if you need to reach out to counselors under telehealth through that option, they have a list of counselors who you can see remotely. And so we could talk about that if that was the best situation for you.
Okay, awesome. That's super helpful. Thank you. All right, Bronwyn, what's the next one here?
Online, it says that fall insurance coverage started on August 1st. Can I access the health center and schedule a medical appointment now?
So if you are a new student, you won't actually have access to those services until next week, which is Flex Week, right, Abby? Do I have that right? Oh.
If it's already the week before classes, that's next week.
Yes. Yep. So if you're a new incoming student, you will have access to those services starting August 17th, which is next Monday, if I have my dates correct. So you will have your coverage backdated if by chance you needed to seek medical care if you're already here in the US between August 1st and now, you will still have that insurance coverage available, but for accessing all of those services at the health network, it starts next Monday for everyone.
Great. I've tried signing up with my Ameriben and I get the following error message. Error, we apologize at this point, your information cannot be verified. If you're still experiencing registration issues, please contact your agent. And he followed up just saying, how can he fix this? I believe all my information is correct.
Okay, so that one is a little bit of a multi-part answer. If you had recently registered, it takes all of the systems to connect about 10 days from the day that you actually register for classes to being active in Ameriben and Anthem systems. So if it was, just recently that you had registered before trying to access your Ameriben, there is that bit of a delay. So go ahead and I would recommend trying it again if it's been a little while. If not, you can always call Ameriben or email them. That information is on our webpage as well, the main student health insurance page. The number for Ameriben is on that, as well as going into their website, you can email them too, just to make sure that they have all your information in there correct. That is obviously a separate website, so we don't manage it, unfortunately, but they are really responsive when you reach out to them.
Great. If I have any pre-existing health conditions, am I able to see a doctor and get my prescriptions? Also, is there a limit to the amount of prescriptions I can get?
So you are absolutely able to see a medical provider and get prescriptions for that. The only limitation that I would like to mention is our pharmacy at the health network may or may not be able to get in every single medication that you would be on. So it's always a good idea to check with them. If by chance there's a medication that your provider is prescribing that they would not be able to get in at the health network pharmacy, you could absolutely take that prescription to an outside pharmacy. You would just have a copay for those outside prescriptions.
Okay. Am I able to do a tuberculosis test on campus if I haven't yet done so?
So traditionally, the answer would be yes. However, because of coronavirus, we are limiting the types of services that we are able to provide to students in our facility at the current moment. So I guess, unfortunately, my answer to that is I don't know right now off the top of my head. So for the student that is asking about receiving a tuberculosis assessment on campus, I would encourage you to please give us a call and ask to speak to, at that point, that would be, I believe, our immunizations department, and they will be able to guide you if you are still able to receive that on campus, or they would be able to refer you to somewhere in the area that would be able to provide that test for you.
Do I have to pay for dental services? Which services are required to get paid in order to access them?
So for dental services, and for this semester, we've gotten word that our dental clinic will not be seeing people for preventative care, but if you do have a dental issue that comes up and you want that checked out, you can always call them and make an appointment. So dental services will be covered under the flex dollars. So for the student health insurance plan, for this upcoming plan year, you do get 250 flex dollars that can be used for non-covered services like dental and optometry.
Great. Is the meningococcal vaccine obligatory for students living in university student halls or for the university apartments as well?
So for any student that is living in on-campus housing, which does include the residence halls as well as, I believe, university apartments, the meningococcal vaccination is required, yes.
And just, I don't think we've gotten it, but just in case, is it required if they're living off campus?
If you are living off campus in housing that is not owned basically by the university, no, it is not required that you get the meningococcal vaccination. In that case, you would just need to have your 2 doses of the MMR vaccination.
For the transfer international students, are there any required actions in terms of health history or records?
Yes, so transfer students are required to have all of the same immunizations, as well as providing your health history and TB assessment. So all of those are the same, and that even includes our required modules as well, all the way down to alcohol, EDU, and sexual assault prevention. So whether you are a first-year incoming student or a transfer student, all of these requirements do apply to you.
Okay. We have a few questions about translations of immunization records. Do they need to be official transcriptions? Can the students transcribe them themselves?
What an excellent question. Generally, someone from immunizations would be here to answer that question, and so I apologize that they are not on this call. I am unsure, and I would encourage you to call our immunizations department and see kind of exactly how that works. So I would assume they would take an unofficial translation. They just basically need to be able to read them, right? But they also need to show that it's true and that it's signed by a doctor and all that stuff. So please call our immunizations department. They'll be able to guide you. And I apologize that I don't know that exact answer off the top of my head.
Okay. What if I have everything complete on time except for the meningococcal vaccine, since I might not get an appointment on time?
Yeah, great question. So the deadline to submit those required immunizations, as I had mentioned, is the first day of classes. However, we're not going to prevent you from going to classes in the fall semester. Things will work exactly the way that they would normally. However, you will not be able to register for spring semester classes until you have provided proof of that meningococcal vaccination. So you will still be able to attend fall classes. We just encourage you to get that immunization requirement met as soon as possible, and that required documentation submitted to our immunizations department. And then as soon as you submit that, whether it's September, October, whatever the case may be, then that hold will be taken off your student account and you will be able to register for spring semester and all will be good.
Great. Do I need to take a tuberculosis shot?
To meet the requirement, no. The tuberculosis assessment is just an online screener questionnaire. So I think it's maybe 5 questions that you're going to be answering online. And then those questions will just assess your potential exposure to tuberculosis. So there's no requirements to have a vaccine or a test or anything. It's just those questions that are required.
Okay. Can someone take these vaccinations, MMR and meningococcal, once they arrive in CSU at the CSU Health Services in case they haven't yet?
So generally the answer is yes. Again, I would encourage you to call. I know we're still trying to work out exactly what our services will look like for the fall semester because of COVID-19. And unfortunately, I personally am still waiting to hear that. I don't know if those have come out yet, and I just don't know. So give us a call. But that being said, if you cannot receive them at the health center, you can receive those at an in-network provider somewhere in the community. So even when you come to the Fort Collins community, you can still receive those vaccinations. It's just, I don't know because of COVID-19 if we are still offering those to new students at this time. So please give us a call. And then if we can't give you those vaccinations, we can at least refer you to somewhere in the community that would be able to provide them to you.
Oh, and I just have one thing I just want to jump in real quick. For all students, the student insurance office right now at this moment are unable to take phone calls. So I just wanted to let you know the few different options that you have. If for some reason you do, like Abby was saying, contact the health network and they're unable to provide those immunizations in person there, go ahead and reach out to our office and we can kind of help you navigate what those next steps are. We do have a chat feature on our website. So if you go to health.colostate.edu under the health insurance tab, if you click student health insurance plan, it will take you to our main website and there's a chat feature. If you click in the bottom right of your screen, that will pop up a chat. And we do have representatives from our office on there Monday through Friday, 9 a.m. to 4 p.m. So that's a little bit of a quicker way to get a hold of us and get questions answered. We do have email available as well, and our email address is on that same webpage, but we are recommending that students use the chat feature as a quicker way to get a hold of our office.
Great, thank you. Since I'll be starting this fall semester from my home country and I have health insurance here, will I still have to have the CSU health insurance?
So the answer is no. Hopefully you have already gotten an email sent to your CSU affiliated email address about those different options. One of them being a student who is starting classes still, but not in the US physically. You will be able to complete, we're labeling it a COVID waiver just because it's not a regular international student waiver. It's a special one just for this semester as we are all dealing with COVID around the world. So if by chance you have not received that email with the link of that special COVID waiver, feel free to reach out to our office, our CSU HN insurance inbox email, which is on our website, and we will go ahead and make sure that you do get the opportunity to waive out since you're not going to be in the US.
And I might chat that email actually in the chat function for any of those of you who have questions about the student health insurance plan. Katie, would that be okay?
Perfect, that would be great.
Great. Next question. So do we need to submit MMR and MC vaccination proof by August 24th, even if we are attending online? And we have a few questions about this. They are getting guidance from our office, OIP, that if they are not coming in person until spring, that they don't have to do this. So if we could get clarification on that.
Yeah, I can tell you right now what I know, and then maybe Bronwyn, we can even chat and make sure that we're getting the correct information out to students too.
Okay.
What I have been told by our immunizations office is that at any point during your time here at CSU, so I mean like your entire college career at the university, if you are going to be on campus or living in those, right, because the question was about MMR, right? I think it was. So if at any point you're going to be on campus during those 4 years, if you're, 2 years, depending upon whatever it is, the MMR is required. And so that deadline does hold up, which is the first day of classes. So you will need to complete that, and that hold will still apply on your student account. So the answer is yes, you do need to complete that, knowing that at some point you will be coming to campus. So yes, you do need to complete that by the first day of classes. Even if you're not coming to Fort Collins until the spring semester, that deadline still applies.
Okay, thank you. I have taken MMR vaccines with the intent to join last spring, but unfortunately I have to defer to upcoming fall online. In that case, should I take the vaccines if I join next spring in person?
Okay, so that's a great question. Hold on just a second. So the question, it sounds like they received their vaccine a year ago. Is that, am I understanding the question correctly?
I'm thinking maybe this spring. I'm not really
Okay.
sure if it's last spring, like last year, or this past spring this year.
Sure. Okay. So basically, I am, I do not have any medical degrees, but the MMR vaccination is not something that you have to get yearly. It's something that you get once, and it lasts for a long time. So if you have already received the MMR vaccination and you submit proof of that to our immunizations department, you should be able to have that requirement completed. They will be able to tell you if you need to get another, whether it's a booster or another MMR vaccine, they'll be able to tell you that. But it sounds like if you got yours within the last year, you are fine, and that requirement has already been met as long as you submit the proof of that vaccination to our immunizations department.
Okay. Next question. I do not have any immunization records. What should I do?
Yeah, so if you don't have any immunization records, I'm going to assume, so there's two ways that you can answer that, right? I don't have any immunizations, I haven't received these. So if that's the case, then we definitely encourage you to give us a call, see if you can get those immunizations at our facility. And again, if not, we can tell you where in the Fort Collins community you can receive those immunizations. But if you just don't have records of the immunizations that you may have already received, there are ways that we can give a test basically to immunity to see if you have at some point in your life received those vaccinations. So it's just a matter of you don't have them on record, or you've just never received them at all. So you have options either way.
Thank you. Okay, next one. I completed the TB survey today. On the I have not spent time in X country option, on the left it says 1 month, 4 consecutive weeks. On the left where you see all the names of the countries, it says 2 months/6 weeks. I think that might be worth the time for someone to check the form. So I guess just letting you know that maybe in one place it says 4 weeks, and in another place it says 2 months or 6 weeks.
Yeah, we thank you for that feedback. I appreciate that. We're definitely always looking for ways to make our communications more clear for students. My guess, and I haven't seen that form, is it might be that depending on certain countries, depending upon where that is, the requirement for the length of stay is different. So some countries it may kind of flag at 4 weeks, some countries it may flag at 6 weeks. But I think that that's certainly something that we look into, and I appreciate that feedback, and I'm going to make a note of that right now. So thank you.
Awesome. So I think you mentioned at some point that dental services are not covered on the insurance plan. So the question in response to that was, can I use my flex money for dental services?
Yes, so flex dollars are available for students who have the student health insurance plan for those non-covered services. Like I said previously, they are only good at the services provided by the health network. So for this semester, from what I've heard so far, dental services aren't providing preventative care for this semester. With that being said, if you are going to be a student next semester as well, your flex dollars are good for the whole plan year. So if by chance you're not able to get the service done in fall semester, you will have those flex dollars good from August 1st of this year all the way until July 31st of next year with the student health insurance plan, as long as you are registered for classes next semester and obviously here and able to get them through the health network.
Great. Am I required to take the alcohol EDU if I'm 26?
So that's a great question, and there is an age limit on alcohol EDU, and let me confirm this before I give you the wrong information. So just hold on 1 second here. I believe alcohol EDU is 23. So if that's the case, you do not have to take alcohol EDU. Yep, if you are under the age of 23, you must take alcohol EDU. So since you are 26, alcohol EDU is not a requirement. Sexual assault prevention is the only requirement. And so in that case, I believe that will actually show up that way in your RAM web. We kind of can see how old you are and filter out the required modules based on that. So yeah, great question.
Another student asked, how do you know if you have completed the alcohol EDU? So how can they tell if they've done it?
So I believe, so you access both of these programs through your RamWeb account, and I believe there should be some sort of check mark on RamWeb once you have completed those. There are two parts. So there's an initial part that you will do upon arrival to, or I guess upon the start of the semester, and then another that you'll complete about halfway through the semester. But you should get those check boxes on RamWeb to show you if you've at least met that initial requirement.
Awesome. Do I need to access the digital ID card available via Ameriben while I am studying online from my home country?
So that's kind of a tricky one. If you're studying online and you have the student health insurance plan, there are very limited benefits while you're in another country. So if that's the case and you do want to go ahead and waive out, there is that option if you have some sort of other coverage or there's universal health care in the country that you're in, you can have the option to waive. So I guess it would kind of depend on if you are planning on staying there for the whole semester or if you are trying to come to the US, come to CSU physically, like halfway through the semester. So if you're going to use services outside of the health network, if you're planning on doing that, then you should go ahead and access your insurance card just to have it in case you do need to give it for any services.
Great. Let's see, do I have to submit the immunization records, health forms, fulfill health insurance requirement, alcohol EDU, if I already did that prior to the spring 2020 semester at INTU?
Great question. And to be honest, I don't know. I think from my understanding, I think INTU students might be classified a little bit differently. But so I don't know if all of those blanket requirements are the same. So I would say check your RamWeb account and see if those boxes are checked or see if those requirements are still there. And that's probably a good way to know. But I would assume probably not if you've already submitted, like you already have shown the university that you have those required vaccinations, you shouldn't be needing to show them proof again. It should still be on file. And if you've already done alcohol EDU and sexual assault prevention at the university, we should also already have those records on file. So I would say you're probably okay.
Okay. I have a couple questions that are like this. So I'm an international PhD student / GTA, graduate teaching assistant on a scholarship. I would like to know if I'm required to pay the SHIP premiums out of pocket or if these premium fees are covered in my scholarship. This is for when I resume physically in CSU.
Okay, so from what I know, GTAs fall into that category depending on the number of hours they're working and whatnot. So some of them do get a stipend from their program that they're working under, that the insurance premium does get put on the student account, and then that stipend does get put on later by the program to cover the cost. I always encourage though to reach out to the graduate school just because they would be able to give you an affirmative answer if the number of hours you're working in conjunction with your program, if you qualify or not for that stipend for the student health insurance.
Great, thank you. If the deadline for immunization records won't be met on time, will the hold be removed once I send in the necessary documents, or will the hold be there the whole semester?
Yeah, the hold will be removed as soon as we have received your documents and we've reviewed them and we've made sure that they are compliant and that you've met the requirements. So as soon as you send those in, I would say within a couple weeks, that hold will be removed.
Great. I'll be starting this fall semester from my home country. Do I still have to complete this Ameriben login and get the ID card?
So if you are going to remain enrolled on the student health insurance plan, we do recommend as soon as possible that every student does go ahead and get their insurance card. You can download it right to your phone from Ameriben. That way, if you need to seek emergency care or anything like that, you have already done it and you're able to provide your insurance right away to whatever services you're seeking.
Okay. Can I completely opt out from health insurance plan while not in the US?
Yes. So there is that special COVID waiver form, and Abby, I think, is going to work on putting that into the chat or however that looks. You should have already received an email with that link in there. If by chance, and we were talking about it a little bit beforehand, if by chance you click on the link and it doesn't work, you can copy and paste the URL and you should be able to access that form. What we'll do is our office receives those forms and then we go ahead and review the information that you've put in there. And then you will, if it meets all of our requirements, we will be in contact with you about whether it's approved and what that looks like for you. But there is a way to opt out of having the health insurance if you're not physically going to be in the US for fall semester.
Yeah, and I'm going to be adding that international students COVID insurance waiver link right now into the chat. So if that was your question, or if you have any other, or if there are other people on this call that are going through the same thing, you can click that link and complete the international COVID waiver. So look for that in the chat here in a second.
Great. Abby, we also got a question. If you could share the video that you played during the presentation, someone would like to watch the complete version of it. So since you're going to share some things in the chat.
Yeah, I will do my best to find that video that's actually embedded into my PowerPoint slide. So I don't have the direct link, but I think I've found one since you chatted that question in that looks pretty similar and should be providing the same information. So I will also link that URL in the chat too.
Great, thank you. I do not have any immunization records, yet I'm starting remotely. How do I go about that? So because they have to submit them by August 24th, I guess. I think that's what the question is about.
I guess my question would be, again, do you not have did you receive the immunizations and you don't have them on record, or have you just not received the immunizations at all? So depending upon what you've done, if you have not received the immunizations at all, I would encourage you to go and receive them if you're able to receive them in your home country. And if you're not, and you know that you're going to be coming to Fort Collins at some point during the fall semester, whatever that may look like, you can wait to meet that requirement until you get here. Again, that hold will still just be on your student account until you submit those records. Or if you are just unsure if you have received them because you don't have them on actual record, I would encourage you to talk to a medical provider, and you can actually, I believe it's called a titer test that can show if you have received those vaccinations. So you can ask for that. So I guess that is just, you know, do you just not have proof of them, or do you just have you not received them? So that's kind of how you can go about both of those. And I am making note about international students and immunization records, planning to reach out to our immunizations office after this call so we can get clarity on that. And so I'm sure there will be upcoming messaging on our website, health.colostate.edu, depending upon what we find out, because I can see the issue that this is presenting here. And so I appreciate these comments and that feedback.
Great. Does the health network cover women's gynecologist visits and birth control? What exactly does the network cover in terms of women's care?
Absolutely, yeah. If you are enrolled in the student health insurance plan, whatever care you're seeking, including women's care, would be covered in full at the CSU Health Network. I know that birth control is covered as well. Usually if it's depending on what kind you get, we do recommend if it's a prescription that you do fill it at the CSU pharmacy if you're able to. But yes, all birth control depending on what various kind is covered.
Great, thank you. Okay. So a couple questions that I think you've answered in some form, so I'll just confirm. How do vaccines for medical students have to be translated? Is there a specific format? It sounds like they should reach out to your vaccination department. Is that the best?
Yes, that's the best way to do it. I wish that I had a concrete answer. I just don't at this point. So I've been typing some links into the chat here. I put the link to the waiver form, the link to the overview of the US healthcare system video, and as well as some information on women's care services at the Health Network. So I'm now going to type out our phone number. And so you can have that information there to call our facility to talk to immunizations as well.
Same with questions about whether or not they can get specific vaccinations once they arrive. Okay.
Exactly. And I would encourage you all to continue to check our website, because I do think, I'm sure that these are things that our staff are thinking of right now, and they just, they may not, that information may not have been disseminated out to everyone yet. So I'm sure that messaging will be coming on our website, and I encourage you to check back here in the next week or so.
Great. Let's see. I'm an international student whose study is paid for by an assistantship position, and I will be resuming online. I received an email on my options on SHIP, one of which was waiving my student insurance until I arrive in Colorado. I'm not sure what that means, and how does the waiver affect the health insurance paid via my assistantship position?
So that's a good question. For that specific question, I'm going to encourage that student to go ahead and reach out to our office. There's a lot of different layers in that, so we just want to make sure that we are answering it correctly for your specific requirements that you're needing. So go ahead and reach out to our CSU HN insurance email. Abby, would you maybe be able to put that too in the chat so that they have access to that?
Yeah.
But yeah, go ahead and reach out to us via email, and we can go ahead and pull up all of the information that we have entered for you in our different systems, just to make sure that we're giving you the most updated answer for your specific situation.
Okay. Because I have completed the CSU International Health Insurance COVID waiver for fall 2020, should I complete health forms, submit MMR, and pay for health insurance?
So,
Oh, Katie, you're muted.
there we go. Okay, sorry. So for the insurance part, you will not be required to pay the insurance premium if you have completed that waiver and we've given you a response letting you know that you will not be required. You won't have to pay the insurance premium since you won't physically be in the US for fall semester.
But you will still need to meet that health records requirement and all of those other new student requirements, even though you'll be learning remotely for the fall semester.
Another question about the deadline, and we have a few questions about this. So it sounds like we may have to follow up with students about this, because I'm guessing that we were told by someone that if they weren't going to be here in person, they didn't have to have it until the semester that they do come. So just for those students that are asking me for clarity, we may have to follow up, but this one is, so as an international student, I'm not sure I have a record of some of the stipulated immunizations, and the time frame for taking the vaccines from a fresh means having getting to the August 24th deadline is almost impossible for me. Please, what are my options as regards to submitting those records?
Yeah, so if you are intending on receiving those vaccinations in your home country and you just can't meet the August 24th deadline for whatever reason, that is only going to impact your registration for the spring semester, which doesn't generally start until October or November. So while you will have that hold on your account, you can still submit those immunization records at any point during the fall semester. The only way that you may incur some trouble is when you're trying to register for spring semester, if at that point you have not yet submitted those records. But if you do not submit them by the start of classes, nothing will change for you for fall semester. The only implication is that you can't register for spring semester classes. And again, you won't even be able to do that until about midway or 3/4 of the way through fall semester anyway. So I just want to reassure students on this call to not panic if that August 24th deadline is coming up too fast and you feel like you can't meet it. We understand that we are living in some unprecedented times throughout the world right now, and that they are going to have to be not necessarily exceptions, but things are not always going to be able to work the way that they used to in a normal semester. And so I don't want you to freak out if you can't meet that deadline. Just know that you can submit it at any point through the fall semester. You just won't be able to register for spring until you do submit those records.
Great. How is contact tracing going to work?
That's a great question. So contact tracing at this moment is actually not done through the university. It's done through our local county health department here in Larimer County. And so they are actually going to be managing contact tracing because they do it for the entire county, not just for the university. So we know that our students are maybe, still running to get groceries or still, living kind of somewhat of those normal things that they have to do to live, right? And so that's actually not done by the university, it's done by the county. And so I'm not sure how that's going to work since that's not done through us.
Great. So someone is asking, what is a Maribin?
So a Maribin is the claims administrator for the student health insurance plan. So it's a little confusing. There's basically 3 parts of the student health insurance plan. You have the student health insurance office, which we help navigate claims and information at the student health network on campus. A Maribin is the claims processor. So if you have any issues with any outside services, any claims processing issues for those services outside of the health network, they are going to be your go-to. They're kind of the middlemen between us and Anthem. Anthem is the insurance carrier, so that's who your actual insurance coverage is going to be through. But for the student health insurance plan, the people at a Maribin are going to help you navigate those claims. You won't ever actually contact Anthem directly, just because for our health insurance plan, we have a Maribin, and they are going to be, like I said, your go-to for any issues or any claims outside of the health network.
Great. So this might be a quarantine question. What should I do if I arrive in the US less than 2 weeks before classes start? Am I able to move into my room? Am I able to attend classes?
Yeah, that's a great question. And I guess my follow-up to that would be, are you referring to on-campus housing? So will you be living at any, student housing at all? And if the answer is yes, you will be living in student housing, I would encourage you to reach out to Housing and Dining and ask those questions. The Health Network at this point, I don't have the answers basically for like room and board or attending classes. So I would encourage you to reach out to housing and ask that question to them directly, or maybe, I don't know, Bronwyn, maybe someone in international programs can help. I'm unsure about how to answer that one.
Yeah, and actually this is my realm. So I just wasn't sure if there was a component that you all covered, but if you are moving into CSU housing, they will work with you. You will be able to move in, and then they will provide the guidance on what you'll need to do to self-quarantine for those 2 weeks. You will not be able to attend classes in person. You will have to attend remotely or work with your professors if they don't have a remote option. So I would reach out to housing so you can get those questions specifically answered but you are able to move in. And if you're moving in off campus, you can reach out to me and I can share your information with the environmental services people who will let you know what you need to do. The next question is, I have a progressive scholarship granted to me by Into. Will it cover a partial cost in the future semesters for health insurance?
That is a good question. I'm not sure. I would maybe encourage reaching out to Into specifically, whoever's in charge of that, and just double check. The information I can give you from my end right now is if there is a scholarship or grants, loans that get put onto the student account, if your insurance premium has been input around that same time, all the funds kind of go together. So if that is still in there when your insurance premium is on there, it's possible that it could take a portion of that, but I don't know if there is a way to, through Into, specifically designate that money to go specifically for the insurance premium.
Great, thank you. We're down to the final 4 questions right now. For anyone else that's here though, if you still have questions, go ahead and type them in. You can also raise your hand and I can call on you that way. I submitted all of my immunization records, but there's no check mark on the health network of my RamWeb. What things do I still need?
Yeah, that's a great question. So thank you for submitting all of your immunization records first. And I would, if I were you, I would assume that that requirement is met, even though no check mark is coming up on RamWeb. If for some reason your immunization records maybe like aren't compliant, whatever that may be, our immunizations records department will reach out to you directly. So unless you hear from our immunizations department, you don't have to worry about your immunizations anymore since you've already submitted them.
Great. Another question about Ameriben. I can't access it from my home country. Is there any other way to download or access it?
There isn't that I know of. The Student Health Insurance Office doesn't have any record, or we don't keep any of the insurance cards with us. Maybe I would recommend reaching out via, if you can't over the internet, maybe via the phone. You can try and call them and see if there are any other options. Just because I'm not completely sure, but if you reach out to them, I'm sure they should have possibly a different way to access it if you're not able to do it via internet.
I'm gonna jump in here real quick, and Katie, you can guide me on this, but from what I'm hearing and what I'm understanding, if a student is going to be living in their home country for the fall semester, and if they already have coverage in their home country, they're not required to have the student health insurance plan. So would it be safe to assume that if I'm an international student and I'm living in my home country, even for a part of the fall semester, I should complete that COVID waiver form? And then in that case, I wouldn't even have to be worrying about Ameriben until I'm on campus. Does that sound correct?
Yeah, if you do have insurance coverage through your country or an employer, parents, anything like that in your home country, you do not need to have the student health insurance. Maybe a point of clarification that we could go over is if by chance you're going to be online and you're planning on coming at some point in time throughout the semester, what you can do is go ahead and fill out the COVID waiver with the information that you have about whatever your coverage is, where you're currently at. And then we would work with the Office of International Programs whenever you would be coming to make sure that you do have the insurance that would meet the insurance requirement when you're here physically in the US. But yeah, if you're going to be online and you aren't physically going to be in the US at any point in time in the fall semester, there is not a requirement for you to have the student health insurance plan.
Great, thank you. Another person who's having issues with Ameriben, wondering if their resources are only available when they arrive in the US. And then someone, just also to add to that in case that helps people, one of our other participants actually recommended using a VPN to access their website.
Okay. You will have insurance coverage while you're abroad as well. We do recommend reaching out to Ameriben. Like you said, you can always try calling them too. If by chance you are abroad and you don't have your insurance card or you haven't been able to access that, there is another way that you can go about still submitting those claims for the services that you did have to Anthem. We do have claim forms on our website. It's a little bit of a process. So if you're in that boat and you've received services but aren't able to access your insurance card, go ahead and reach out to our office via email and we can help you walk through the steps of what you would need to do if for some reason you aren't able to get a hold of or contact Ameriben directly.
Great, thank you. Another question about spouses this time. So what about spouses? My wife is coming to Fort Collins with me. What are the health requirements for her? Does she have to show immunization proof and does she have to apply for health insurance too?
Great question. So if your spouse is not attending the university, none of those requirements apply. So all of these requirements are only if you are an enrolled student at CSU. So if you have spouse or kids, none of these actually apply to them, and only students can even enroll in the student health insurance plan. So none of this applies to spouses or children.
Great. And I will add that if you're bringing a spouse, it's a good thing to check with our office because some visa status or some visas do require that spouses have insurance. So our office can direct them to plans that would work for them. So just to double check with our office. And the last question that we have right now is, how long should I wait before signing up for the card at Ameriben?
So the answer for that is to do it as soon as you are able to. Like I said before, just so that you have that at your fingertips if you do have an emergency situation or something come up where you would need to seek services outside of the health network. You, like I said, can download it right to your phone and just save it so that you're able to pull it up if you do have to have any of those outside services. The caveat to that is it depends on when you register as to when you'll be active in a Ameriben system and able to access that. So it takes about 10 days from whenever you register until when you're going to be active and able to get into a Ameriben system. So that's just something to keep in mind as well. If it has been a length of time, go ahead and reach out to Ameriben via the phone number that is on our website or their email address, just to make sure that there isn't something that's incorrect on their end. We want to make sure that your information is entered correct throughout the system so that you don't have any issues in seeking services or verifying that your coverage is active.
Great. So we have gotten to the end of all the questions that we had before. And I appreciate your time, Abby and Katie and Andrew when he was here earlier. I just want to give attendees one more chance. If they have any questions, raise your hand, put it in the chat, put it in the Q&A, so that if we don't have any more, then that would be the end of this session. Otherwise, I think we're okay. I did share with them that I will reach out to everyone with the clarification on all the questions about the deadlines. Just to let students know kind of what that looks like and how it will affect them if they don't have it in time, et cetera. We can follow up on that. But is there anything else you all want to share before we head off?
I just want to thank everyone so much for taking the time to attend this presentation. I know it's a lot of information and at sometimes it can probably feel overwhelming. And I also want to thank you for bearing with us as we also navigate this interesting world of living with coronavirus right now. And so thank you. And Bronwyn will be in touch obviously with that clarification. And we just hope that you have a healthy semester and just know that we are here to truly support you in your success as a CSU student, whatever that looks like.
Mm-hmm. Yes, thank you so much for being flexible with us as we, like Abby said, are trying to navigate these waters. Our office is working on currently trying to get a phone system set up. But like I said, until then, we do have the chat feature off of our main webpage. That way you can get a hold of us within seconds, which the email tends to get a little bit backed up, so it might take us a few days to respond to you via email. So we are available either way. That chat feature is really awesome and a new thing for us until we can kind of get our phones back on track. So feel free to reach out if you have any questions, big or small, and we are available to help you whenever we're able to. So hope you do have a healthy and safe semester while you're going.
And we did get 2 more questions.
Oh, sure.
So thank you for your time. Just to be sure, Ameriben is not required if I will waive out from SHIP.
Correct. Yes, those are all tied together. So if you are not on the student health insurance plan, you do not need to do anything with Ameriben.
And I do want to note here too that Katie makes a great point about all of the insurance offices being remote and that they're only available via chat or email. But that 970-491-7121, that number is still active, and that's our main CSU Health Network number. So if you do have questions about medical or counseling, you can call that number. But if you do have insurance related questions, please email or chat the office that Katie's in.
Great. And then the last one that has come in is, how do I apply for my health insurance as a quarter-time GTA?
So kind of what we were covering before, I do encourage you to reach out to the graduate school if you're not sure if you are in that category that qualifies for that stipend. But the way that that would work is make sure that you sign up for the student insurance. If you're, well, you'll be automatically enrolled if you're an international student. Let me take that back. So you'll have the insurance premium placed on your account. And then if you do qualify for that stipend, I believe it's sometime around add drop is when the graduate school will go ahead and put that stipend for the insurance premium right directly to your student account.
Great. So we've gotten through all the questions. We have some thank yous coming in, but I don't see any other questions. So yeah, if you all have anything else you can share or that you want to share, you can. Otherwise, I think we're good.
I think that's it for us.
Yep, Sam.
Great. Well, thank you for everyone who participated. If you do have any other remaining questions, feel free to email me and I will send them to the appropriate people. I will not answer them, don't worry. But if you do have questions, you can reach out and I will forward them to the right people. You can also look in the chat to see what information Abby and Katie provided. And we will also be making this recording live on, or not live, I guess, but we'll put it on our website once we have it formatted and everything. So you can always go back and look to see if you have any questions. Otherwise, thank you, Abby and Katie, for your time. And thank you for everyone who participated, regardless of where you were from. I know we had a few people that are in different parts of the world right now with weird time zones. So I appreciate everyone hopping on this webinar. And that's it.
So thank you. Have a good day.
Thanks, everyone.
Bye.